Hey, this is Matt. Welcome back to the channel, guys, where I'm going to be talking about the low-level laser therapy, LLLT. Is it still a viable method for treating your hair loss? Will men or women, on the other hand, respond better to low-level laser therapy? What does the research say so far? I'm going to be also sharing with you two studies. In the first study, there will be a device, laser cap, utilizing only medical lasers, versus in the second study, we're going to be looking at the efficacy of another laser cap, which is utilizing medical grade lasers as well as LEDs, and we're going to be also comparing their both efficacies, and we'll be finding out whether the laser cap should have more of the medical grade lasers or also some LEDs, or a mixture, or just medical grade lasers. What's better? Let's find out together in this video, guys, how many hairs a laser cap is in fact able to grow on paper. Let's start with the video. This video has been brought to you by GoFiber, which are hair building fibers you can use to mask any thinning or patchy areas on your scalp to make your hair look thicker and better. So make sure you check out the link in the video description below, where you can visit GoFiber, get a free sample of your choice from them, and try them out, see if you like them. Guys, welcome back to the channel. Glad you're here. Make sure you like and subscribe to this channel if you are new. And without further ado, let's just dive right into the topic of today's video. LLLT, is it worth it in 2021? As you see here in the picture, there are many different laser devices, which some of you guys may know more or less. This video is not going to be about these particular devices, but if you want, I can make a comparison video on different devices. Comment below if you want me to do such comparison. Now, before I share with you the studies and what LLLT is able to do in terms of hair growth in a certain period of treatment, let me talk about a little bit about the mechanism of action of this treatment. Low-level laser therapy involves the use of light within the visible red 600 to 700 nanometer range that is produced from a laser or light-emitting diode, LED source. These wavelengths coincide with the optical window of mammalian skin, that is the wavelength at which there is maximal absorption of light. Low-level laser therapy has been further found to enhance the expression of signaling molecules of the WNT/beta-catenin pathway, which is involved in the initiation of growth and development of hair follicles. Now, the study will be linked down below. Additionally, the irradiation causes an increase in blood circulation at the dermal papilla, which provides a boost of metabolic activity to the proliferating cells. And there's also some additional hypothetical type of mechanism of action of LLLT. It has been hypothesized to drive telogen follicles into anagen phase and prolong its duration, something like minoxidil is doing. However, this mechanism of action hasn't been scientifically proven as of now. Now, moving on to LLLT problems, guys. Some of you guys who have been already using low-level laser therapy device from Capillus, iRestore, HairMax, Terradome, iGrow, and so on, probably know that the results you got from this treatment have been probably either inconsistent, or the results were so minimal that it resulted in discontinuation of the treatment, okay? You didn't have any more patience or time, or you didn't have enough nerves to continue with the treatment every other day for like 30 minutes because you didn't see results, so you got demotivated. And I see this happening a lot in this industry because number one, it's not FDA approved treatment for hair loss. Why it is not FDA approved treatment for hair loss? Because there is not enough data, there is not enough strong supporting evidence that this treatment is in fact can be like even on a comparable strength of finasteride efficacy or minoxidil efficacy. Well, it's not, and that's why it's not FDA approved. That's why these treatments like iRestore, Capillus, HairMax, and all these combs and helmets are just FDA cleared, which means they are safe to use, but unfortunately they hasn't been shown as effective as minoxidil or finasteride. Furthermore, studies done on low-level laser therapy have been done on very small sample sizes, usually less than 100 subjects. Studies are also no longer than 24 weeks. That means no longer than 6 months, and that kind of questions the long-term efficacy of low-level laser therapy. We don't know what's going to happen long-term, whether the efficacy starts to stagnate after like a couple months, or whether we can see continuous improvement with with regular use of low-level laser therapy over years and years. We don't know that. And oftentimes we also see studies done on low-level laser therapy which have been funded by laser cap companies, and that kind of brings the conflict of interest, and we don't know, we are not sure whether we can trust these studies. So this is another disadvantage or problem in this industry. And the last problem would be the lack of standardization, as we see with PRP therapy, platelet-rich plasma therapy. We don't know what is the optimal helmet, how it should be built. Should there be more medical grade lasers? Should there be also some LEDs or just medical lasers? Some studies are saying that a helmet should have only medical grade lasers because these are better, higher quality, they're more expensive and whatnot. And other studies show also good results with caps or helmets utilizing LEDs only, surprisingly. So where is the truth? Not enough evidence. With that being said, guys, let's take a look at our first study done on low-level laser therapy and hair regrowth. Unfortunately, the sample size is pretty low, as it's usual with these studies on low-level laser therapy. We have 40 subjects, 20 men and 20 women. Males were between Norwood 3 and Norwood 5 hair loss pattern. Females were between 1 and 2, but that's the female pattern hair loss progression scale. It's the Ludwig scale. And the regimen was using the laser helmet 3 times per week, 20 minutes per treatment, and the study duration was 24 weeks. The device which was used in the study was so-called RAMA cap, and this one had only laser diodes, like 224 of them, no LEDs. So that's really interesting, because there are some people who've been recently claiming that the LEDs are no good, they're cheap, and they are not penetrating as deep as the lasers, the medical grade lasers, and that's why I chose also this one. And on top of that, it seems like this helmet cannot be even bought like on Amazon. It seems to be some type of prototype, and this is obviously a double-blind sham device control trial, and I feel like there will not be like a conflict of interest, because I don't see any company standing behind creating this study. Because if we take a look at the affiliations, we see Division of Dermatology, Faculty of Medicine, Hospital, University, Bangkok, Thailand. So it doesn't seem like there is a big company like laser cap company behind this study. So anyways, what are the results? Now, target area hair count, that is a circular area with a surface of square centimeter, which had been as selected on the scalp for examination. At the beginning, it had 112.4 hairs per this area, and as a result of this 24-week treatment with this laser cap, it increased on 122.6 hairs, which is a 9% increase, and in terms of hairs, it's 10.2 hairs more per square centimeter, which is actually pretty good. However, guys, effectively it's not 9%, but only 5.5%. Why? Because if we take a look at the placebo group, we see that the hair density per this target area also increased in about 3.5%. Now, as far as hair thickness, this is also interesting. It seems like up to the week number 8, the placebo group and the RAMA cap or laser cap group had similar improvement in hair thickness, but from the week 8 to the week 24, it seems like the group using the laser cap had significantly better hair thickening compared to the placebo group. Now, as much as I would love this to be like a noticeable cosmetic improvement, guys, it may not be even visible at all. Why? Unfortunately, we don't have any baseline hair thickness levels. We just know that the laser treatment resulted in 6 microns improvement in hair thickness, and the placebo group resulted in 3.7 microns improvement in hair shaft thickness. Now, how thick is your hair shaft? Well, on average it can be 50 to 70 microns thick. If your hair shaft is already miniaturized, it can be maybe 30 microns thick. Okay, so let's assume that your hair thickness at the baseline is on average 30 microns because you have some miniaturized hairs on the target area. So let's say that in this case we have seen an improvement of 6 microns in 24 weeks by RAMACAP laser cap group, and that would have been about 20% increase. In the placebo group we have seen 3.76 we see an improvement in hair shaft thickness in about 3.76 microns, and that would have been 13% improvement still. So we see an effective increase in target area hair width, okay, in hair shaft thickness in about 7%. If we assume that the baseline hair thickness was about 30 microns. So again, 7% increase in your hair thickness, you will not notice, okay? You will not notice that. You may notice maybe 20% hair thickness improvement and higher, but not really less than like 10%. It's going to be very unlikely that you will notice that. Okay, let me visually illustrate to you the results of this study which we have just described and discussed. So we see four before and after results in this photo. On the left we see 2 males and on the right we see 2 females. So if we take a look at the first male before and after result, it actually does look better, especially this thing. If we observe it here, I think it really got better in this area. As far as this area here, I'm not sure whether it got better. I just think that the hair got longer, and as far as the area on the crown, which was balding before, I think it might have got more narrow on the after photo. So there is an improvement even if we evaluate it visually without any trichoscopic evaluation. As far as the other photo, we see a crown area which was thinning, and after it's still pretty much the same. In my opinion, I don't see a big improvement in the second case right here. Okay, this is not a big improvement. If we take a look at the before and after result number 3, we see definitely some improvement, especially in this area here, which I think got a little bit narrow, and it seems like the hair looks more pigmented. I don't know, maybe it was just flashed with too much light on this photo here. I have no idea, but on the right here it just looks more darker. And on the fourth photo we see also not such an improvement in my opinion. Alright guys, now let's talk about the second study on low-level laser therapy which I chose because I also consider it to be like a really good placebo-controlled trial, and let me explain you why. In this study they used iRestore laser helmet consisting out of LEDs and lasers, and this one helmet also had the placebo part in the helmet. So the left portion or the right portion, I don't know which one exactly, was the placebo part with just some random light, which is not having the 650 nanometer length. It's not the red light, it's some other light. And the other side had the LEDs and medical grade lasers. Okay, so it was like that. So that's really interesting, isn't it? I haven't found any other study doing it this way. And before I share with you the results, let me share with you the study design. So in the study, 100 subjects were enrolled. The regimen was 3 treatments per week and 30 minutes per treatment. The study duration was also 24 weeks as with the first study, and the device was iRestore laser helmet, which had the LEDs, 27 of them, and laser diodes, also 27 of them. So actually not so many as the helmet in the first study, which had I think 224 laser diodes. So let's take a look at the results of this study. In this study, after the clinical evaluation, they have seen improvement in coverage. Now, how good was the improvement? If we take a look at the part on the right, treated with the actual iRestore lasers and LEDs, we see a 14.2% improvement in coverage. I assume it's the target area hair count increase. That's amazing, 14%. However, if there wouldn't have been a placebo part, we would have said, wow, it's amazing. But since we see there is also the placebo part of the head experienced also 11.8% improvement in coverage, whatever that improvement in coverage means. Improvement in hair target area hair count, I don't know what they mean, they haven't specified it unfortunately, but what's more important is that the effective improvement in coverage is only 2.4%, because we see that even the placebo treated part of the scalp experienced a pretty good improvement on average. Okay, the limitation of this study would be that they did not really provide us with the information how the target area hair width improved, how the hair thickness improved as a result of this treatment with LLLT. They said that it significantly improved from baseline, hair thickness, but they did not specify, they did not quantify it. And also they did not distinguish between male and female response to LLLT. They just included males and females in the study, but we don't know what was the male response and what was the female response. Now, unfortunately, I don't think there is a study which would have been observing the effects of low-level laser therapy on both sexes, men and women separately, but I would definitely say that women on average do respond better to low-level laser therapy for multiple reasons, simply because female hair loss is less androgen mediated than male hair loss, and the hair loss which women experience can be caused much more often than not by things like vitamin and mineral deficiencies, low protein diets, stress related, caused by traction alopecia. The hair loss by women can be also misinterpreted with hair breakage. They just see a lot of hairs kind of on their hands and in the sink and they think it's hair loss, but it may be just hair breakage as a result of over processing that hair by permanent hair dye, perming, bleaching, frequent blow drying, etc. And in such case, if you use a laser helmet consisting out of medical grade lasers, it can actually improve that hair loss and improve that hair quality. And that's why I think as a woman you are more likely to notice some cosmetic improvements on your hair by using a laser device compared to when you are a male, because if you are a male and you are not targeting your hair loss with any anti-androgen like, or 5-alpha reductase inhibitor effectively, and you just relying on laser helmet, it's very unlikely that you will notice benefits from that helmet, because DHT is kind of miniaturizing the hair follicles faster than the laser helmet can even attempt to thicken that hair from outside. It just, the miniaturization is faster than that recovery or potential recovery benefits of LLLT from outside. All right guys, that was pretty much it for this video. We're talking about the mechanism of action of low-level laser therapy, some problems. Oftentimes, if the study on laser therapy is not including placebo group, the results may be very misleading and the results may look much better than they are in reality. But once you see the placebo group as well included in the study, that's why it has to be always placebo-controlled trial, the results are not that significant as you have seen in both studies, and the effective increase in either target area hair count or hair thickness may not be as good, may not even be noticeable. And that's why if you're reading these studies on low-level laser therapy, the increases in target area hair count or hair density or coverage, you should take them with a grain of salt, all these numbers, because in reality, if you take a look at these photos, oftentimes you cannot even tell the difference. So that's how I would also summarize many of these studies on low-level laser therapy. There's definitely more information that we could delve into in maybe another video on different laser devices which are utilizing more or less of the lasers or more or less of the LEDs. So if you want, I can do a comparison on some devices on the market. Make sure you comment below if you're interested in such video where we can delve deeper into LEDs, lasers, and which one is better, which one is worth the money, which one is overpriced, and which laser cap could actually be a good use of your money and time. So if you're interested, make sure you comment below again. Other than that, thank you so much for watching. Make sure you like this video and subscribe. Check out my free Facebook group, Hair Transplant Experiences, with 3,000 members in the group. Check out maddominance.com, my website, where you can either check out some of my hair transplant related guides on how to properly research your doctor, your hair transplant clinic, how to find the best hair transplant clinics in Turkey. You can also get on a one-on-one call with me where we can discuss hair loss related topics, hair transplants. I can assist you throughout your hair transplant research myself. And with that being said, thank you so much again, and I'm going to be seeing you in another video. Take care.